Hi everyone, my name is Maggie Vernelli, and in this short video, I will discuss the topic I chose for my final paper, the importance of leadership collaboration in healthcare. I work in an administrative department, business intelligence, that provides support to our health system's clinical areas by providing data and reports for leaders to make decisions. Data is invaluable in healthcare, and we have way more requests than we have the capacity to support. At the staff level, we rely on management to provide us direction on what we should work on and why. I've been in this department for 3 years, and oftentimes I feel that we work in a bubble. So, we will receive a request to build a dashboard for some topic, let's say readmissions. Our leadership tends to decide on behalf of operations what we should include in the dashboard and how it should look. The team spends weeks, sometimes months, creating the underlying data to support the project and the visualizations on the dashboard. If we have questions about the data or how something should look, our management is the one that will provide us the answers. We are in a position that we trust management is having these discussions with operations to ensure that the work we're doing is correct. We get to a point where we have a final product and we're ready to demo it to operations. When we do so, we receive a magnitude of feedback for changes that we need to make in order for our dashboard to be usable to them. The team then needs to go back to the starting point, since a lot of the changes requested were things that we could have done earlier on if we would have known that's what they really wanted. We spend more hours and weeks on the work involved to incorporate their feedback, and then we'll deliver them the final product. Months later, we'll look at a usage report and find out that no one in operations is using the dashboard we created. The team gets extremely discouraged and our morale is down because we feel like the work and time and effort we put into something is meaningless. So, how can leadership fix this problem? In my opinion, we need to pop the bubble that we're currently working in and begin to collaborate. There's plenty of literature on the power of collaboration and leadership in the healthcare setting. Areas where I found that there was a gap in literature was effective collaboration between clinical operations and administrative departments in healthcare. In my area specifically, there's a lack of collaboration between us and operations to ensure that the work we are producing is meaningful and that the clinicians can use it. I think leadership's in a position where they can bridge the gap by promoting an environment where collaboration is the first step to solving a problem. The focus of my paper will be to take a deep dive into the importance of collaboration at the leadership level, specifically between clinical and non-clinical areas. My paper will provide the following information as follows. First, I want to look at what is collaboration and why is it important. In this section, I'll look at the literature that's currently available on the topic. Next, I want to assess how the lack of collaboration can impact healthcare. This includes impacts on work productivity, critical decision-making, and employee morale. Next, I want to assess how leaders can promote a collaborative work environment. So in this section, I want to look at what skills does a leader need to promote collaboration, what leadership styles are best in line with collaboration, and what are the benefits of a collaborative atmosphere. I then plan to conclude with a summary of the discussion, as well as recommendations to leadership on opportunities to improve the work environment that I described earlier. So thank you everyone for taking the time to listen to the topic I plan to discuss in my final paper. I look forward to reading your feedback. Thanks again.